Good evening. My name is Tiffany Thomas, and I am here tonight to talk to you about your children's mental health. I am from the Mental Health Association of Maryland, and I am their program manager of education and outreach, and I work specifically on the Children's Mental Health Matters campaign. I'd like to introduce you to Carrie.
So sorry, we'll get all these technical difficulties worked out. Good afternoon, I'm Carrie Gorkas, and I oversee a number of our programs at the Mental Health Association of Maryland, and one of them is the Children's Campaign that Tiffany's already mentioned. And I'm so excited to be here with you this afternoon to add bits and pieces here and there as we go along with Tiffany.
So the Children's Mental Health Matters campaign has been around for 20 years, but start in 2021, this will be the 13th year that the Mental Health Association of Maryland and the Maryland Coalition of Families have partnered together to bring awareness across the state and education around children's mental health through schools and through community organizations. We do this through various ways, through social media and publications and resources, and you can get involved by visiting our website, which is childrensmentalhealthmatters.org, or reaching out to me via email, and you'll hear more about our campaign and how you can get involved around the beginning of next year. So today we're going to be talking about various things such as what is mental health, what is mental illness, the prevalence of mental health disorders and different illnesses. We'll be touching on suicide and how to seek help for youth that you're concerned about. And we'll talk about the teen brain and recovery for those youth that are struggling, and some resources that will be helpful for you to save in case you ever find yourself in a situation that you would need them or someone that you care about would need them also. So it's easy to know if you or someone that you love would have a fever or broken bone, but mental health problems can be a little harder to identify. The tricky part is knowing that the kind of behaviors and moods that are usual or typical for this stage of development that you or your child are in when what you're experiencing has gone beyond the norm. So it's really important to pay attention to what's appropriate in their different developmental stages. And if you have any concerns, to talk about that with their pediatrician or another trusted adult like their school counselor. So just paying attention to developmental milestones and things like that so that you can know what is developmental appropriate versus what's a little bit beyond the norm if you have any concerns. So when we're talking about mental health, it's really important when we're discussing this with friends or family or other people in order to help reduce stigma around it if we talk about it. And we can do that by starting that by talking about it at home. So that's the first place to do it. Do you talk about mental health at home with your kids? And an easy way to do that is by reading chapter books or reading little picture books with your kids. And you can find a lot of these in your library, or we even have a book list on our website that you can find for younger children, and we have a book list for older kids. It's really, really important to start that conversation with your kids early so that they feel comfortable talking about their mental health. So as they're developing, that they feel comfortable coming to you when they're struggling and they have a trusted adult in their life that they can talk to. And it's important for you as the adult in their life to talk about your own mental health. Of course, there is appropriate things to share and things that aren't appropriate to share, but it's important for you to model what good mental health is for your children and to let them know that it's okay when you're struggling too. And if you're seeking help for yourself, to let them know how you're doing that. If you're going to therapy, if you're seeking help beyond that, to let them know that it's okay that you're struggling and it's okay that you're having a hard day, or it's good that you're having a good day, and having those conversations in a healthy and open setting so that they know that it's okay if they struggle too. And who do you talk to about your mental health? So who do you as the adult in your family talk to about your mental health, and giving them people in their life to talk to about their mental health? It doesn't have to necessarily be you, but setting that example so that they can talk to you, but also providing them opportunities to have other adults, safe adults in their life to talk to as well. That's really, really important for developing children, to have those safe adults to set an example and have those safe conversations with, but also for you as the adult to take care of yourself. And then another important question when talking about mental health is, how would you explain what mental health is to your child? And there, like I said in the beginning, a good way to do that is to get books that I referenced to from our book list to talk about what mental health is. You can talk about emotions, you can talk about fear, you can talk about, anxiety or feeling sad. There's lots of ways to start that conversation. Um, and if you need resources, you can reach out to me via email, or you can reach out to your school counselor. There are lots of really great opportunities to help you with that. So like a person's physical health, mental health is an important part of growing up and developing. As we're growing up and developing, a physical health and meeting those milestones is really important. But if we're not developing appropriate social skills and mental health skills and being able to learn how to talk about our mental health, we can struggle also. Mental health is how we think, how we feel, and how we act. So if we're not able to learn how to talk about our mental health in an appropriate way, as we're developing and as we're growing up, it's going to be harder for us to talk about it as we get older. And you see that with kids sometimes as they're growing up. And when they reach a point when they're struggling, they don't know how to talk about or how to reach out for help. And it's really important for us to model that as adults in their life. So now we're going to talk a little bit about what a mental illness or a mental disorder is. There's lots of different terms that you hear floating around about what these are, but we're for the context of this, we're going to call it a mental disorder or a mental illness. And what that is a diagnosable illness that affects a person's thinking, emotional state, and behavior, as well as disrupting a person's ability to work or carry out other daily activities or engage in satisfying personal relationships. So for a child, that could be affecting their schoolwork, affecting their friendships, affecting sports or other activities such as theater or groups or clubs or church activities that they love. And this affects their day-to-day life. So if you see a big change in them, that's something that's really to be concerned about. If you're feeling that way an adult, that's something that you need to pay attention to as well. And of course, with recent events and with COVID, we're all being affected so deeply by this. And so it's really important to pay attention to how your life is normally versus how it is now, and reach out for help should you need that. So Carrie's going to talk a little bit about the spectrum of mental illness with you.
Thank you, Tiffany. So we really like this graphic because it gives, I think, a good detail in this specific instance around anxiety. So on the left, you'll see that the curve is very small. So a small minority have a severe disorder. And again, if we're going back to what Tiffany was just talking about, severe would mean that it is really affecting your ability to carry out your daily routine. And then you move to, if you're going kind of up the screen on the left, then you have kind of the minority, which is a mild to moderate disorder. So that could be where anxiety is affecting your daily routine, but it's not keeping you, for instance, at home 24 hours a day, 7 days a week, because you're too afraid to leave. And most of us who struggle with anxiety then sit in that mild to moderate disorder. And then in the middle is the vast majority who are kind of in that normal state, and they're able to carry out their daily routines. They're doing okay. They're managing their anxiety. And then you'll see that you can kind of go back down on that right, back to a mild or moderate disorder, and then again to that severe disorder where it's really affecting your ability to carry out your daily routine. And all diagnosable illnesses, mental illnesses, are on kind of this spectrum. You may have years where you're doing really good, and then times where things get bad and you're struggling, whether it's anxiety, depression, substance use, whatever it is, you're going to have those kinds of, peaks and balances. And for some of us, it may be a long, long time where we're doing okay. And then there's that blip.
So now we're going to talk about how common mental disorders are, and we're going to talk about how common they are for adults and how they are for youth. So for adults, 20% of the United States population ages 18 through 54 are affected by a mental health disorder during any given year, and about 57% of that population will have a diagnosable disorder in their lifetime. And we'll talk a little bit about onset of that in just a little bit. For youth, the prevalence of mental disorders in children and youth is also estimated to be about 20%. Many young people with mental disorders do not seek or have access to professional help. In 2009, about a third of adolescents who have experienced a past year major depressive episode have received treatment. There are lots of reasons for that. It can be due to lack of resources. It can be due to fear of speaking up. It can be due to, parents being worried about whether this is a normal thing for them to experience, or is it something that they should be reaching out for more help. It can be for various reasons. Mental health disorders can affect a person's entire life and family, but the most important thing that we want you to leave this presentation knowing is that the earlier that mental health disorders are treated, the far better the outcomes are for children. There's so much research that shows that early childhood, if a child's struggling, if you start then, the far better outcome there are for kids who are struggling later in life. If you can find treatment and support for them. And experiencing mental health symptoms as a child and seeing your child struggle with those symptoms can be extremely overwhelming and confusing and scary sometimes, but it's extremely important that you speak up and help them speak up for themselves and help them ask for help, and that you ask for help for them if they're not able to when they're not feeling right, so that together you can figure out the next steps and find the right treatment for them. So 1/2 of all lifetime cases of mental health or mental illness begin by the age of 24. So for anxiety disorders, the median age of onset is age 7. For eating disorders, the median age of onset is age 12. For substance use disorders, a median age of onset is age 15. For schizophrenia, the age is 22. Bipolar disorder, the age is 25. And for depression, the age is 32. Now, this doesn't mean that your child can't experience these things earlier or they won't experience them later. This is just the median age of onset. If you have concerns about any of these disorders or you have questions about them, we really encourage you to look at our resources. We have resource fact sheets on a lot of these mental illnesses on our website, or if you would like to speak to a professional, reach out to your school counselor or talk to your pediatrician about any of them. We have information available about them. But these are the median ages of onset for each of these disorders.
And Tiffany, if I could just jump in for a second, I think this kind of median age of onset chart is really helpful to kind of sell why it's so important to talk about these illnesses early and get treatment early, because 7 is young. I remember when I first heard that age range and I was flabbergasted because I didn't think that children could struggle from anxiety disorders. And I also want to point out that depression is age 32 because there are so many cases of depression in older adults. So it skews that median age of onset. It's not that there aren't kids who are struggling with depression, and lots of kids are struggling with depression. It's that we have kind of across the lifespan with depression versus some of these others. You're not likely to develop bipolar disorder, for instance, in late life. But depression certainly can affect someone in late life. So that's why that age of onset is so old.
And I think that seeing that age of onset for anxiety being age 7 just reminds us how important it is to teach children appropriate coping skills for anxiety or anything that they're struggling with, and for you as an adult to model those as well when you're struggling, because let's be honest, we all struggle with something at some point, and if we can model that for our kids, they're more likely to use them when they're struggling as well. And if we can do that now, they will likely be able to have a better outcome later in their life when they're struggling and when hardships come their way. So here is a little bit of data for you when it comes to mental disorders during adolescence, which is such an important time of development in a child's life. So the U.S. Youth with a mental disorder during adolescence, which is considered ages 13 through 18, 31.9% of youth struggle with anxiety disorders. Behavior disorders are 19.1%. Mood disorders are 14.3%, and substance use disorders are 11.4%. When looking at this, it's obvious that anxiety disorders are the most prevalent, which just goes back to the last point of what I just said and why it's so important to teach kids appropriate coping skills and to help them build resiliency and just those strengths at an early age, so that as they continue to get older, they can practice those skills and know how to cope as they become teenagers and develop through adolescence. Do you have anything to add here, Carrie?
So the thing that I would add is I know these terms are a little bit different than some of the terms we've used on earlier slides. I just wanted to address that behavior disorders are things like conduct disorders.
Mm-hmm.
So the DSM-5, which is sort of the big book used to give behavioral health diagnoses, is updated every 5-10 years or so. And behavior disorders is a newer term for things like conduct disorder and oppositional defiant disorder. And so I just wanted to clarify that. And then mood disorders is something new, relatively new, that you'll see, which is to cover things like depression. And just wanted to point that out in case people were confused about those terms, because I know they confuse me.
So speaking of depression, we're going to highlight depression for this webinar and talk about it specifically. So youth with symptoms of depression show behaviors that cause distress for the child and problems with social relationships and difficulties in school and home and other dynamics in their life. Some of the symptoms for depression include intense sadness, being irritable and grouchy, losing interest in their daily activities that they used to enjoy. So we're talking activities that they do on a daily basis or a weekly basis. Losing interest in their friends that they spend a lot of their time with. Complaints, chronic complaints of feeling ill, especially stomach aches and headaches, and doing poorly in school. Um, you know, there's a lot going on in our country and in our world right now. And so you have to look at this really closely because there's been so many changes for our youth and for our kids right now that they're having to adapt to. And it's really important to remember that kids can adapt very well. But looking at them closely and seeing how they continue to adapt or if they struggle. If your children are continuing to struggle and they're not adapting, that's when you need to be concerned. And some of these symptoms are some things that you can look for. So if your kids are, it's just that right now everyone's learning to adapt to virtual learning or hybrid learning, and so give them some time before you judge whether they're doing poorly in school, because there are a lot of kids struggling. But as time goes on and if they're continuing to do poorly, or they're not wanting to do it, talk to their school counselor, talk to their teacher, send their teacher an email and see if you can have a chat with them about how you can help them engage in class. If they're complaining about feeling sick all the time, you know, take some time and keep a record of it, whether you put it on your calendar, on your phone, and just keep a record of how they're feeling. That way you have something to look back on and say, on these days they weren't feeling well and it's starting to become a trend, and you can talk to their doctor or their counselor about it. If you have a kid who plays baseball and has been on a team and then all of a sudden they're not wanting to go do it anymore, have a conversation with them about why they're feeling that way. And if they don't want to talk to you, see if their coach will talk to them. Sometimes they don't want to talk to their parents, and that's okay. That's not an insult. Sometimes they're just not wanting to, and maybe another adult is an option. But these are some symptoms that you can look for, and it's just really important to gauge what's going on in their life and see if it's affecting them long term. And yeah, so the next slide that we're going to look at talks about the prevalence of depression in adolescents, and obviously looking here, female teenagers struggle the most. 16.2% of females struggle the most with depression, compared to 5.3% of males. And then overall, here we have 11.4%. If you're looking at the age, it's pretty consistent between the ages of 15 and 17. You got 13%, 13.1, 13.2%. There's so much going on in their lives at that point. Changes in friendships, changes in hormones, changes in social relationships that can affect what's going on in their life. You just have to look at it in a developmentally appropriate way and decide, is this affecting them just right now, or are they able to push through and be resilient, or is it affecting them long term? Do you have anything you want to add here, Carrie?
I don't think so. Actually, I think you did a really good job of describing this slide. The only thing that I will add is I tend to think that the female numbers are so much higher because girls and women are more comfortable admitting that they're struggling,
Yes.
whereas males may be less likely to report that they're feeling signs and symptoms of depression or anxiety.
So how does depression affect youth? When compared to their same age peers, youth who display symptoms of depression have lower academic performance, are more likely to attempt suicide, are more likely to have unprotected sex, and are more likely to use substances. So what we're looking at here are higher risks and lower performance. So you could say that they could also be performing less in sports or in the activities that they're doing, not just school. So they're checking out. They're checking out and doing higher risk behavior. So those are some things that you can look for there too. Now we're going to move on to anxiety, which if you remember starts, the median onset of age is age 7. So this is a pretty big topic and something that you should really pay attention to as kids are developing and getting older. Children and adolescents with anxiety disorders experience extreme feelings of panic, fear, or discomfort in everyday situations. Now, I know I have a little guy who, for the longest time, had some fears that we were worried that he would never get over. And for a while, we were concerned that we may need to talk to somebody, but eventually we just gave him a little more time and he moved on. It's that paying attention to whether they push through or if it lingers. That's really, really important. But if you ever have concerns, like we've said multiple times, reach out to somebody that you trust and talk to them about your concerns. Everyday anxiety disorders are the most common type of mental health disorders in children, affecting nearly 13% of young people. I'm not going to read over all of these different types of anxiety disorders, but there are a few that I want to point out. The first one that I want to point out is generalized anxiety disorder, which is at the bottom here, which is the most common diagnosis for anxiety disorders, which is experiencing 6 months or more of persistent, irrational, and extreme worry about many different things. So, this could be about anything, honestly. It could be about, being in social groups. It could be about,
Taking is something that I think about.
what did you say? I'm sorry. Oh,
Test taking.
test taking, yeah. Having to speak in front of groups, having to take medicine, or I'm trying to, like, if a child's had a serious illness, having to go to the doctor, any type of medical, issues or fears, things like that. So if a child's had a serious illness or a serious accident, they might struggle with post-traumatic stress disorder. That's pretty common after a traumatic event or an accident or something like that. Panic disorders, some children and adolescents may struggle with that before having to take a test or speaking in front of a crowd or, having to address somebody. I'm just trying to think of specific examples, but these are the most common types of anxiety disorders that we see. And if you have questions about any of these, like I said, reach out to a professional or you can reach out to us and we can connect you with appropriate resources for them.
And Tiffany, I would just add, I think one thing that it's important to note with generalized anxiety disorders is that irrational piece. As Tiffany kind of mentioned, the list that she said, the test taking or speaking in front of people. So those are things that a lot of us struggle with. And they're things that are very common everyday things. So yes, I'm worried about taking this test, and that's okay. But if I really focus on that test and take it to kind of the next level, and it becomes irrational, then that's when it might be a problem. And again, it's that 6 months, which is a long time in a young person's life. Which is helpful, I think, to know because it gives you a time frame to kind of monitor some of this stuff.
And the tip that I mentioned before, using some type of calendar to monitor and track your child's feelings, is a really good tool to do that. So whether you do it on your phone or you're writing it down, that way you have something to show your doctor or a psychiatrist or psychologist. That way you can show them, hey, this is how long my child's been struggling with this. This is the behavior that they're having. This is what they're scared of this day and this day. That way you have something tangible to show them, and they can see that, this is what's been going on. So that's a really good tip to do, and it's just a really easy way to track what's been going on with your child. So moving on to crisis services and talking about irrational things, and when talking about depression, we talked about high risk behavior. We're going to talk about crisis services here and what a mental health crisis is. And so that's defined as a time of intense difficulty, trouble, or danger. And so what those things could look like are severe disruptive behavior, aggressive or threatening behaviors, self-injurious behaviors, acute psychosis, suicide or suicidal thoughts, or threats to harm themselves or other people. So these are all really big, intense moments that are crisis for themselves, for you, or for somebody else. And this is the point where you need to reach out for help in that moment, or the school has needing to reach out for help in that moment. And the help that they need is beyond your capability and your expertise. And so we're going to move on and talk about suicide, and then at the end of that we're going to talk about some resources for you for crisis services, and at the very end talk about recovery. And so we just want to talk about suicide because it is the second leading cause for death for youth in this country. And if you have questions about any of these other intense difficulties for youth, feel free to reach out to us. But for this webinar, we're going to talk about suicide.
And Tiffany, could I just add that not every non-suicidal self-injury instance is a mental health crisis.
Yes.
But a lot of times we as parents or outsiders aren't going to know because there's an injury and we think
Yes.
injury needs immediate care. But again, just paying attention to how serious is the injury. It may not be a suicide attempt. It may not be a mental health crisis. Certainly something you and your child want to address, but it may not be an emergency.
So not every young person who is depressed or anxious is at risk for suicide. That's something that you are going to have to assess with your child's doctor, with their psychiatrist, or their therapist, if you choose to put them in therapeutic services. But not every young person who is struggling with depression or has anxiety is going to have suicidal thoughts or attempt suicide. And that's really important to remember. Suicide is different from self-injury. Self-injury can be a means to escape from a reality that a person is feeling, and a way to release the pain that they're feeling. And suicide is a means to escape from it fully, completely. Um, a young person may feel so overwhelmed and helpless that the future appears hopeless, and they may think that suicide is the only way out. And it's really important to help youth know that their life is important, and that whatever they're going through isn't what their life is going to end up being. That there is more beyond the moment that they're experiencing now, and that they can find help, and that there is hope beyond the moment they're experiencing now, that there is life beyond this, and helping them develop those coping skills in an early age and develop resilience and strength and see what their strengths are is really important so that they know that there is hope for their future. Um, Sometimes young people act quickly or impulsively, and that's developmentally appropriate for them. And that's really important to remember as well, especially when you're talking to them about this. You wouldn't want to come down on them harshly for the thoughts that they're having or the actions that they might have, because they're the choices that they're making and acting impulsively and having these risky thoughts are developmentally appropriate. But just having a conversation with them and keeping the conversation open and honest and safe and loving is really important so that they can want to continue to talk to you. The risk for suicide is increased if a young person has been using alcohol or substances. And that is really important to remember when thinking about the environment that your children are spending their time in or have access to. So building these relationships with them or making sure that they have adults that they can talk to about where they're spending their time and about their lives is extremely important. Do you have anything to add here, Carrie? No. Okay. So looking at the numbers around suicide, 44,000, just over 44,000 Americans die by suicide each year. That's 121 suicides per day in the United States. For every completed suicide, there are 25 attempts. Females are more likely to attempt suicide, and males are more likely to complete suicide. And like we mentioned a few minutes ago, suicide is the second leading cause of death for youth in the United States. You can read more about this data on the American Foundation for Suicide Prevention website. This is drastic. This is eye-opening. This is so important for thinking about why having these conversations with your youth or any youth that you have contact with are so important in developing those relationships and having those safe places for kids to have someone to talk to, and knowing that they have that open place to come and vent and just be who they are and talk about what's going on in their life is so crucial. Looking at this graphic is from Mental Health First Aid. There's a lot of information here. I just want to point at some of the statistics here. For many young people, when they start to experience signs and symptoms during adolescence, it has a really big impact on their life moving forward. And like we've said multiple times, the earlier that they recognize there's a problem and get help and get support, the greater likelihood of recovery there is. That's the biggest thing we want you to leave this presentation knowing. The other big statistic on this graphic is that every day in the United States, over 5,000 students in grades 7 through 12 attempt suicide. And 4 out of 5 of those students have given clear warning signs to somebody in their life. We just have to open our eyes to see them. That is huge. So you have youth and children in your life. Pay attention to the warning signs and don't be afraid to ask them what's going on in their life. So here are some of the signs and symptoms that we can look for in youth. Threatening to hurt or kill themselves, seeking access to means to do so, talking about death, dying, or suicide, and that can be vocally, on social media, you know, by any means, expressing hopelessness or no reason for living, having rage, anger, or revenge-seeking feelings, acting recklessly, so that wild acting out, feeling trapped, increased alcohol or substance use, withdrawing from friends and family, dramatic change in mood, sleeping all the time or never. And this is this is really important. We'll talk a little bit about the teen brain in just a little bit. Teenagers need a lot of sleep. So if you notice a huge change in the amount of sleep that they have compared to normal, that's that's a huge sign. Um, but they do sleep more often than other children and adults. So just pay attention to the amount compared to normal. Being anxious or agitated and giving their very beloved belongings away to their friends or to siblings or other people that they know and love. So let's say that you have a youth in your life, a child in your life that you're worried about. Where do you go? You're overwhelmed, you're scared, you don't know who to talk to. You might be ashamed to reach out for help. Those are some things that parents struggle with, those feelings, and you just don't know where to go. So here's some tips. Feel free to write this down, put it in your notes in your phone in case you or a friend or someone is struggling. They can reach out to friends and family like you who are watching this webinar. They can reach out to a spiritual counselor if you have one, to their school counselor, to their child's pediatrician, or even your doctor. You can reach out and talk to them. You can reach out to the crisis numbers that we're going to give you towards the end of this presentation. Building strong relationships and having the knowledge of risks, of warning signs of suicide and depression, and having the access to prevention and intervention resources will often decrease the likelihood of suicide in youth. So having resources around your family, having strong relationships around your family and around your youth and around your children can decrease the likelihood of suicide in youth, can help build resiliency around your family. And that's really important right now during this time of COVID, is having relationships around your family. We're all struggling, we're all dealing with loneliness, we're all dealing with isolation, and we get through that by having community. And if you're struggling, reach out and find support groups, reach out and find groups with people that you have the similar things that you like to do, and do to help your kids do the same thing. They're gonna see you doing that, and they're gonna want to do the same thing, and it's just really important for them to build that community for themselves.
And Tiffany, another group that I always direct parents to is teachers, especially for younger kids. But I do think even middle and high school, reach out and say, I've been noticing these things at home. Are you noticing them in class? And getting that validation. If the teacher says, "Oh yeah, I totally have noticed that," then I think that's something important to note. I also think our kids are much different in the classroom than they are at home, right? They're perfect angels all day at school, and then they come home and give us the hard time. But I think it's just having that open conversation with their teacher or teachers about what they're seeing and noticing, because then that's going to put that idea in the teacher's head to pay attention and see what they might be doing in class, and that can be really helpful as well.
So you're probably wondering what you can say to your child if you're worried about them struggling with suicidal thoughts, or any of these mental illnesses we've talked about, but specifically suicide. So some of those questions that you can specifically ask, and we really advise you to be specific, are you having thoughts of suicide? Are you thinking about killing yourself? Those are two questions. You need to specifically use direct words and terminology and be specific in asking. Being specific will give you specific answers. Other things you can do are pay attention to your child's social media accounts and the relationships that they have with their friends. Talk to your child and let them know that you care and that you're here to help them. If they don't want to talk to you now, remind them that you're there and that your door is open and that they can talk to you always. And they may not want to talk to you right away, but they may come another day to talk to you. It's most important to remember that you always take suicide seriously. It's should never be taken as a joke. No threat or comment about it should be taken as a joke. You should always tell somebody and reach out for help for your child or anyone that makes a comment or a threat about it, and that you don't tell secrets. And this is important to share with your children too, when it comes to their friends, because they may have friends that may text or share something on social media about it, and they need to know that they should not keep secrets for their friends who may be struggling as well. So this goes for you as a parent, and this goes for your children to know also, so that they can help keep their friends safe too. So here are some important numbers that we really encourage you to save in your phone. You can take a picture of it right now with your phone. We'll leave it up for a minute for you. Save these numbers in your phone, put them on your computer, share them with your kids to put in their phone. And there's the National Suicide Prevention Lifeline, the Maryland Crisis Hotline, the crisis text line. For kids who just don't want to talk on the phone, they can text and get some support, and then the Prince George's County Crisis Hotline. So we'll leave this up for you for a second. Take a picture of it, save it, and encourage your kids. Share this with your kids too, so that they have some resources for their friends if they have friends that are struggling. All right, the next slide is just a graphic that talks about what is average for a teenager or what's a warning sign. Average teenager, withdrawing from family a little bit more to spend more time with friends. That's totally normal. Their family's probably not as cool as their friends anymore. Mom and dad, you're just not as fun, and that's okay. But what's a warning sign is that they're withdrawing from everything. They're withdrawing from their friends, they're withdrawing from family, they're withdrawing from their social activities, and they're kind of just not doing anything. That's a warning sign to look for. Another average typical thing for a teenager is that they want more privacy. They don't want you snooping around, looking in their life. They want you to leave them alone. What's a warning sign is that they're becoming secretive, and that they're hiding something. There's a difference between wanting privacy and being secretive. If they want privacy, it should still be okay if you ask them if you can look at something and they're not trying to hide it. Whereas being secretive is that, they're really trying to hide something from you. There's a little bit of a difference there. And lastly here is moving from childhood likes to teen pursuits. That's totally normal. Your daughter's probably not going to want to play with Barbies anymore, or, like those cute little tiny girl things anymore, and move on to whatever teenagers like now, I don't even know. And a warning sign here, losing interest in favorite activities and not replacing them with other things. So just not doing anything, not having any passions about anything. We should all be interested in something to keep our lives interesting, and you should be encouraging your kids to do the same, so that their brains are staying active and that they're learning new things every day. That's really important for their development at this point in their life. So speaking of development, we're going to talk about the teen brain to wrap up a little bit. There are 6 things to know about the teen brain. Number 1, the brain does not continue to get larger as you get older. Girls' brains stop growing at age 11. The largest it gets is when they're at age 11, and boys is at age 14. And this does not mean that boys are smarter. They're just at a different development.
Right.
Go ahead. No, go ahead.
I just was going to add that I think sometimes we equivalent, size with some aptitude, and that isn't what this means. It just means that the actual growth of the brain, so the size of it, really kind of stops at 11 for girls and 14 at boys. It doesn't mean, though, that the brain doesn't stop learning how to use its components. So that happens all the way up until 22, 23 years old. This is just to show the size. The size of the brain really doesn't grow past 11 for girls and 14 for boys.
There are so many different things that are happening to the brain during this point of their life. And that's why it's so hard to know whether a teenager is experiencing mental health struggles sometimes or if this is normal. So that's why it's just important to keep track and ask questions and have that really good relationship with your teenager and keep that conversation open. Next, number 2, even though the brain stops growing, it does not mean that the brain isn't finished maturing. Like Carrie said, this doesn't happen until the mid to late 20s. The prefrontal cortex is one of the last brain regions to mature, and that part of the brain is responsible for planning, prioritizing, and controlling impulses, which explains their ability to control themselves and all the risks that they take, throughout their 20s and college life and all of that. Number 3, the teen brain is ready to learn and adapt. It's so important to continue to teach teenagers coping skills and things that they can do to take care of themselves during this point in their life. They learn so much in this point of development, and their brains are so adaptable, and they can soak in so much. And so if you're willing to show them and model good mental health for them, they are going to soak that in and know exactly how to take care of themselves and model that for their friends too, which is really, really important. Number 4, many mental disorders appear during adolescence. All the big changes the brain goes through may explain why disorders develop during this time. It is a light show up there during this time. There's a lot going on. It's just a lot, and it explains why they're moody and can't make up their mind, and there's just a lot going on. I remember being a teenager and it was not fun. I would not go back to that period of my life. So show your kids some forgiveness and keep that conversation going. And number 5, the teen brain is resilient. We've said that a lot. It's a tough time to navigate, but most go on to become healthy adults. Number 6, like I said earlier, teenagers need more sleep than children and adults. So don't ride on your kids, your teenagers, for sleeping. They're not lazy. Most have a higher sleep hormone during this time of development and naturally rise and stay awake later. I know it doesn't make sense and it doesn't seem fair, but the 9 and 10 hours of sleep is a must for them. So mom and dad, grandma and grandpa, lighten up a little bit, let them sleep. So we're going to talk about recovery for a minute. It's absolutely possible for everyone, no matter their age, no matter what they're going through, to recover, but recovery looks different for everybody, depending on what they've gone through in their life, what their families have gone through, their environment, what they're experiencing, generational trauma, etc. It will look different for everybody, but it is possible. It takes hard work. It takes a community around them. It takes persistence, but it is possible. There's a quote here that says, "A process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential." That's what recovery is. And recovery isn't a one-time thing. It's a lifelong process for folks. It looks like failure one day and picking up your bootstraps and trying again tomorrow. And that's really important, and it's really important to teach your kids that too. We'll leave you with some resources here. Our website, which is childrensmentalhealthmatters.org. We have a lot of resources for families, for educators and providers, some resources for teens and youth. On our website, we have a download section where you can download fact sheets for the different mental diagnoses, and a family resource kit and activity sheets for kids. There's so much information and resources on our website. I encourage you to get on there and look around. If you need something specific or looking for something specific, reach out to me via email. I can help you find it. The Mental Health Association of Maryland has a website. It's mhamd.org. We have lots of resources there also, for mental health across the lifespan, um, for pregnant and new moms, for older adults, for everyone. So we encourage you to get on there and look around. And then our partner for the Children's Mental Health Matters campaign, Maryland Coalition of Families, their website's mdcoalition.org. You can go on their website and find support groups for families across the state. There's lots of information and resources. You don't have to go through this alone. It's really important to find a community for you. And like I said, if you have questions about anything that you've seen in this presentation, please reach out to me. I know that there isn't a live Q&A, but we really encourage you to reach out. Shoot me an email, and you can send us any questions. If you need a specific resource or you would like any of our publications that you see, all of our resources are free. We can mail them to you. We encourage you to follow us on social media. We're on Facebook, Instagram, and Twitter. And it has been a pleasure sharing information with you, and we hope that you will follow us and reach out to us should you need any resources. Thanks so much, and we hope that you take care of yourselves and your families.
Thanks so much, and take care.